Okay, our next speaker is from New Zealand. We don't often get speakers from New Zealand here, but we're delighted to have Chris Bullen, who's going to be talking on electronic cigarettes.
Thank you. Shall I begin?
Yes, go ahead.
Okay. Well, good morning, everybody. It's 6 a.m. here in New Zealand on Saturday morning, so we're a little. Forgive me if I nod off if things get a bit slow. I'm going to be talking about electronic cigarettes, an opportunity or a threat to health. And here are my interests. I'm a full-time employee of the University of Auckland in New Zealand.
Chris,
can you hear me?
From us or from him?
I'm running my slides myself.
Down the volume on the computer.
So, say that again?
Okay, go ahead.
Okay. Can I run my slides myself? Yeah. Okay. So I'm just showing up a slide showing my declaration of interests. Can you see that one? Yes. Okay. Moving along. So I just want to say that my context here in New Zealand is quite different from yours in the US, and so my comments reflect the situation in one part of the world, and I know it's very different. For example, apart from the fact that it's a day ahead of where you are, and it's winter here in New Zealand, we have a very different way of treating nicotine. So nicotine is regulated as a medicine when it's delivered in tobacco. And currently, e-cigarettes without nicotine can be sold legally, and you can access nicotine liquid or nicotine-containing e-cigarettes only for personal use by importing them. You can't legally purchase those from a retail outlet. However, this regulation is being reviewed as we speak. We don't have any oral tobacco in New Zealand, and we have a national goal of becoming a smoke-free nation by 2025. And the definition of smoke-free is a prevalence of smoking equal or below 5% for all population groups in New Zealand. So we're under some pressure to dramatically reduce smoking prevalence from where it is currently at around about 15% for the whole population. But within some priority population groups, such as Indigenous Maori New Zealanders, it's as high as 45 to 50%. So the aim is to have no one left behind by 2025, and that is why our government is currently entertaining all options for radically transforming the tobacco landscape in New Zealand. So what I want to talk to you about is a little bit of electronic cigarettes 101. In case you weren't aware, there are products out there called e-cigarettes. And I want to look at them, first of all, as an opportunity for health. What's the evidence for that? And then the evidence for e-cigarettes as a threat to health, and then try and draw some conclusions. And this is a large and burgeoning field of scientific endeavor. It's growing incredibly rapidly, and I'm finding it extremely difficult to keep up with the publications that are coming out. 2 years ago, it was possible to keep on top of it. So this is good because very little is still known about these interesting products. So what are e-cigarettes? The World Health Organization calls them ENDS, or electronic nicotine delivery systems. And they said they're devices whose function is to vaporize and deliver to the lungs of the user a chemical mixture typically composed of nicotine, propylene glycol, and other chemicals. E-cigarettes first came to our attention in their current guise when a Chinese chemist by the name of Hong developed the first prototype product in 2003. So in the modern era, if you like, of e-cigarettes, they've really only been around for just over a decade. But if you search the patents office, you can find out that an American gentleman by the name of Herbert Gilbert had the same idea in the early 1960s, and that's the patent office device there, which looks remarkably similar to early electronic cigarettes. The idea of a battery-operated vaporizing product that could replace some of the behavioral, tactile, and oral characteristics of a tobacco cigarette and deliver nicotine in a more pure form than tobacco cigarettes do. The products have advanced a long way from the original electronic cigarettes that Hong developed, and these are some of the images of current products that you might see being used out there. More typical, perhaps, are the ones in the top of the top two runs with very large batteries, which are now able to effectively deliver, and I'll show some data on this, nicotine even more effectively than tobacco cigarettes, which was something that was unimaginable even just a few years ago. So essentially what you have when you break down a generic e-cigarette, you have a battery, you have a reservoir containing e-liquid, liquid which may or may not contain nicotine. It's usually comprised of propylene glycol and vegetable glycerol with some flavorings and some other additives. You have a heating element, which is typically made of metal, and a wick to absorb the e-liquid out of the reservoir and conduct that into the chamber, and then with the battery powering up the heating element, the liquid is vaporized into an aerosol. And the user can press a button to switch on the battery and activate the vaporizing process, or some products have an automatic process where when you suck on the device, it automatically activates the vaporizer and you draw the aerosol into your lungs. So there's no smoke, there's no combustion of tobacco involved. It's purely aerosolization of a fluid, which is a medium for conducting the nicotine. It's the vegetable glycerin and propylene glycol is essentially a medium for conducting nicotine into the lungs. And it's the same mix that's used in rock concerts to create a smoke-like effect on stage of your favorite rock band. So 2004, the first branded e-cigarettes came onto the market in China. These were by a company called Royan. They had a few models. Some of them looked like whiteboard marker pens and looked particularly attractive. They had disposables. They had cartridge devices. We got a hold of a few of those and began to test them later on in the 2000s, and I'll come to that paper in a moment. By 2014, there were 11 new brands coming out a month, and towards the end of 2014, in a study conducted by some US researchers, they counted 466 brands on the market. All differed in nicotine content and the way they held the nicotine, whether in cartridge or in a reservoir which the user could fill with liquid. And there was a massive range of flavors, over 7,700 in January 2014, with 242 new flavors being added per month. I haven't seen a count since then, but I imagine the increase in both brands and flavorings has continued to increase exponentially. And on the side of the slide, you can see the growth in sales globally that's been estimated. And around 2014-15, estimated about 3 billion sales per year, and likely to skyrocket unless there are massive changes in regulation or some other incident to change the trajectory of the sales of e-cigarettes. One of the interesting challenges with trying to study these products is that they're rapidly evolving. So what was an e-cigarette yesterday is no longer really an e-cigarette today. There's a huge amount of adaptation and evolution in the designs and improvements in terms of efficiency of delivery of nicotine. Why have they become so popular so rapidly? There are really very few other products that have gone viral in the tobacco space, apart from, of course, cigarettes. They have become, for many people, almost a perfect substitute for cigarettes. Many smokers these days are well informed and are acquainted with the health risks of smoking and want to do something about their health. They're very convenient. You can carry them in your pocket. They're affordable. People start making savings within a few weeks of purchasing an e-cigarette because they're generally in most constituencies where there's effective tobacco control measures such as taxation. They become quite more affordable to use than purchasing tobacco. So in my country, it costs about US 75 cents per cigarette now, and that's likely to increase by 10% per annum for the foreseeable future. So we're taxing the life out of tobacco. And for people who want to save money, e-cigarettes are an affordable alternative. There's also an interesting phenomenon that's developed, and that's what I call the supportive subculture. It's for some people, it's a hobby. It's become a viral sort of social movement that's fostered through online communication, blogs, etc. There are conventions that resemble Trekkie conventions. There's a lot of information that's shared by users online. It's not all reliable or accurate information, but there's nothing like it in the nicotine replacement therapy space. And so this is effectively a de facto behavioral support and information movement that subverted standard health provider systems. In the vacuum of regulation, there has been some self-regulation by the industry, and so this has given some measure of comfort to some users in terms of the quality of product, but it is a real concern, which we'll discuss in a moment. So in terms of whether e-cigarettes are an opportunity for health or not, one can think of it in terms of individual health opportunity, but also population health opportunity. So under the heading of individual health opportunity, they could prevent would-be smokers from taking up smoking. So, for example, instead of smoking cigarettes, people could become vapors, which, depending on your take on the toxicant exposure from e-cigarettes, could be a less harmful activity. So being a nicotine addict might be better than becoming a nicotine, with e-cigarettes, might be preferable to being a nicotine addict with tobacco cigarettes and inhaling all the 3,000 plus constituents of tobacco smoke. Secondly, there could be an opportunity for personal health improvement by helping smokers quit tobacco smoking, which is about the best thing you can do for your health if you smoke tobacco. They could help smokers cut down smoking to levels that reduce harms, and this is a more controversial proposition because there's mixed evidence around the level of smoking at which you need to see health improvement. From a cardiovascular point of view, it's probable that even one cigarette is a dangerous thing to smoke each day. But from a respiratory health perspective, it seems to be much more of a linear relationship with tobacco smoking volume, if you like, and health harm or improvement, conversely, if you're cutting down. What about at a population level? Well, it's possible that the advent of e-cigarettes or products like them could reduce initiation into tobacco smoking and increase quitting sufficiently to reduce smoking prevalence at a population level. And they could reduce exposure to secondhand smoke. And of course, if everybody who was a smoker switched from smoking cigarettes to vaping, you would instantly get rid of secondhand smoke exposure, but what you have would be secondhand e-cigarette vapor exposure. And we'll have a look if we've got time about that. So we got interested in e-cigarettes, as I said, in the mid-2000s, and we were fortunate enough, I guess, to be first cab off the rank for publishing some early research on these products. A colleague of mine brought some of the Bullen products back from China, and we put them in a randomized crossover study where we had 40 volunteers who were smokers abstained from smoking overnight, and they were randomly assigned on different days to use their usual cigarette, to use a placebo Royan e-cigarette, to use a nicotine-containing Royan cigarette, or to use a nicotine inhalator, a nicotine replacement product. And you can see as we measured time from use and change from baseline desire to smoke, so we're interested in how effectively could these products reduce the urge to smoke after an overnight fast from smoking cigarettes. And the best thing to do to reduce urges to smoke, if you're a smoker and you haven't smoked overnight, is to have a cigarette the next morning. And so that was the most effective way of reducing urges to smoke. Those are the solid black dots in the line on this chart. But the next most effective were the nicotine inhalators, or the electronic nicotine delivery devices. We called them ENDS there in those days, with containing 16 milligrams of nicotine content. The least effective were the placebo or zero nicotine e-cigarettes. And so rapidly, after resuming product use, urges were diminished equivalently so between the nicotine-containing e-cigarette and the nicotine pharmaceutical product, the nicotine inhalator, but not as good as smoking a cigarette. So this gave us, I suppose, impetus to conduct some further research on e-cigarettes. Just to briefly talking about nicotine delivery, this has improved over time with product evolution, and it varies by brand, and you can see these different products that are available in the US and UK, and you can see that these products differ quite dramatically in terms of nicotine delivery over time, number of puffs, some are better than others. And here's research conducted by Hazardous and others published in 2014, which compared different models of cigarettes, called them different generations. So the first generation ones in the lower line with the blue bar were not particularly effective at getting nicotine plasma levels up very quickly, whereas a more modern contemporary device with a higher strength battery and more efficient design characteristics able to produce levels of nicotine much higher and more like those seen when you smoke a cigarette. However, there are very few products as good as delivering nicotine as cigarettes. But substitution is now possible. This is some work that's in preparation from Prevalence and Roswell Cancer Center in Buffalo, New York, and just showing the baseline if a person's a smoker, smoking up to 110 cigarettes per week, then changing weeks 1 and weeks 2 to e-cigarettes, they are able to drop the number of cigarettes smoked almost to 0 and substitute e-cigarettes. And on the right-hand side, just the number of times per day that an e-cigarette was used to offset, if you like, cigarette smoking, about 17 or 18 times of using an e-cigarette a day in this study. And just showing that nicotine equivalents can be obtained if people fast enough, and the concomitant effect of having a massive reduction in carbon monoxide quite quickly over time from baseline smoking tobacco going to using e-cigarettes. In terms of evidence around quitting effectiveness, there is mixed evidence from surveys and cohort studies, and we did some of the early work on this just with internet surveys, which are admittedly crude and heavily biased, but they again pointed to some effectiveness at quitting for some smokers. An overestimate, I think, in the study with Jean-François Etter in Switzerland in 2014, because it was an internet survey, 46% said they'd quit by 1 year, but we know that that's no longer likely to be the case. And there have been a number of cohort studies and other surveys which have a bit of mixed evidence, and some have shown less quitting effectiveness with e-cigarette use, but it depends on the design of the study. If you're taking people who are already e-cigarette users as baseline, you've already eliminated people who were e-cigarette users and successfully quit from your study sample. The Cochrane review published a couple of years ago, which I was a co-author on with Peter Hayek and Hayden McRobbie and Jamie Hutton-Boyce, pulled together the available evidence both from randomized controlled trials and some cohort studies. We're currently updating this review, and that should be out in a few months. But I have to say there's not an awful lot to add since we published this version. The 2 trials that are part of this review were one undertaken by Caponetto and colleagues in Sicily, and one we led in New Zealand, and they had different study populations. So the Caponetto study recruited people who are smokers but didn't want to quit, whereas we followed more the lines of a typical nicotine replacement randomized controlled trial and recruit people who wanted to quit. The 2 products were different, but both of them were what we now call Generation 1 e-cigarettes, which were quite unreliable with weak batteries and relatively poor nicotine delivery. In the Caponetto study, they used lower levels of nicotine. We had 16 milligram e-cigarettes. And we compared our product with nicotine patch in a head-to-head comparison, and also had a 0 nicotine e-cigarette arm, as did the Caponetto study. We followed them over equivalent times for an intervention period, and then the follow-up for Caponetto extended out to 12 months. We followed them up to 6 months, and we both used the measure of primary outcome being continuous abstinence at 6 months. And what did we find? In terms of comparison with nicotine replacement therapy, our study is the only one to date that's been published. We showed a non-significant increase of about 26% comparing nicotine cigarettes with nicotine patch at 6 months. But a post-hoc non-inferiority analysis showed that e-cigarettes with nicotine were at least as effective as nicotine patches. And then when we compare nicotine versus placebo or non-nicotine e-cigarettes, we were able to pull the data from our study with the Caponetto study, and what we found was a doubling or more of quitting efficacy when you compare nicotine-containing e-cigarettes with placebo e-cigarettes, and that was a significant finding. Looking at reduction, in other words, whether e-cigarettes can help people cut down the number of cigarettes they smoke, to find in our studies is greater than or equal to 50% reduction on baseline, we found that there was indeed an effect compared with both placebo and nicotine patch. It was statistically significant when we pulled both studies, or our study, of about a 40% increase in quitting or in cutting down rather than quitting. Now, there have been a number of systematic reviews published since the two randomized controlled trials. In fact, at last count, 13 systematic reviews have been published, and a kind of counterpoint and counterpoint. I've called them dueling systematic reviews because they come to some different conclusions, but they have all included different sets of studies. So the World Health Organization review that was published in 2014 was heavily influenced by some early work from Stan Glantz and colleagues in San Francisco. And they pulled data from not only the trials, but from longitudinal and cross-sectional studies. And the Cochrane and Glantz meta-analysis published in 2016 reported a lower chance of quitting if you used an e-cigarette, but it included 19 non-randomized studies with all their risks of confounding and other sources of bias, as well as the two randomized controlled trials. The Cochrane review that we published didn't include all of the same studies in the WHO review or in the Cochrane and Glantz review. So there's I guess, a debate over which studies go into the mix, and depending on which studies go in the mix, therein you generate your conclusions. There are real concerns with the quality of many of the included studies, and so I suppose the jury could be said to be still out on that. But I think, you know, as a rule, generally when we're doing meta-analyses, we try and include data from randomized controlled trials. The problem is only 2 have been published. There are more in the pipeline. If you go into clinicaltrials.gov, you'll see quite a lot of e-cigarette trials that will be publishing in the next 2 or 3 years, and we'll have to sit on our hands until that point in time. But we do have some evidence from, if you like, real-world studies, and this is a slide showing some data from the UK, published by Jamie Brown and colleagues in Addiction in 2014, and that looked at 5,800 adults who'd smoked within the previous 12 months and tried to make one quit attempt during that period with either an e-cigarette only or nicotine replacement therapy purchased over the counter or used no aid. And what they found was there was a significant advantage in self-reported abstinence compared with no aid and compared with over-the-counter NRT. It showed statistically significant improvement. So this is a real-world study with in the UK with 5,800 plus adults who are wanting to quit smoking. Interestingly, in the UK, if you like, punters who want to quit smoking, people have voted with their feet, and extraordinarily, e-cigarettes have surpassed nicotine replacement therapy as the product of choice for the most recent quit attempt. These data that are collected in a rolling series of surveys by the Smoking in England study have been immensely helpful in tracking e-cigarette use and comparison with other quitting product use. And I would really encourage those of you who are interested in this space to see if you can fund a similar study in your country. We did something a little like it, but it's not as good as the UK data. And I think this is fascinating. It does suggest there might be a tail off here right at the top. This is from February, March, and we're seeing a little decline, but there have been other dips along the way. But I guess what it's saying is that people are finding that nicotine replacement therapy isn't as attractive as it was, despite the availability of National Health Service quit services all across the UK being widely available. People are trying e-cigarettes. What about a population effect? Well, again, from the UK, there was some suggestion that because of the mass reach of e-cigarettes, have grown the use of even modestly effective aids to quit smoking. If you combine that with nicotine replacement therapy to e-cigarettes from 24% in 2010 to 40%, And while there's been some trade-off with the most evidence-based methods, but assuming that you're getting a stable quit rate attempt, this could have contributed, these authors suggest, to about 20,000 additional ex-smokers in the UK, a fractional decrease in smoking prevalence. Now, these are kind of estimate-based, riddled with assumptions, these sorts of studies, but I think they are interesting exercises to do, and we'll have a look at some other data from the US in a minute. So this has just been published. David Levy and colleagues published this in Nicotine and Tobacco Research a month or two ago, and this is, again, some more modelling work looking at never smokers. So this is at the initiation end. Could there be a population health benefit from e-cigarette initiation, surprisingly, looking at the US data? And I've used this decision analytic tree here to plug in some data around all sorts of possible options. Would a person have become a smoker in the absence of VNPs, that's vaporized nicotine products? And what they concluded was that based on all the different current use patterns and various assumptions, including quite conservative assumptions, they project that there would be a reduction of about 21% in smoking attributable deaths and of 20% in life years lost if there were vaporized nicotine products being used by the 1997 US birth cohort compared to a scenario where they weren't at all in the mix. In other words, if they were taken off the market, e-cigarettes went from the market, and people weren't able to use them, they estimate about a 20% gain for health as a result of initiation. And that would come through people who would have smoked using e-cigarettes, which they are saying are much less harmful than cigarettes than just going on to a lifetime of smoking cigarettes. So very interesting data, and this group is continuing to do work looking at the other end with cessation, and we wait with bated breath to see what they come up with. Now, this kind of estimation is having to be done in the absence of longitudinal studies because we just don't have the data tracked over time yet to measure the long-term health effects of e-cigarette use at population level. So moving on to threats to health very quickly, and time's ticking by. This could be threats to health of individuals through reducing or delaying quitting smoking, exposure to more toxicants than if they continued smoking, creating other harms in excess of those from continued smoking, perhaps novel harms from new toxicants, or use by never smokers in a way that might be harmful. And at a population health level, maybe secondhand exposure to vapor, increasing smoking prevalence, renormalizing smoking behavior, or distracting the tobacco control community from key tobacco control efforts and focusing on sort of a sideline issue. So what about hazardous exposures from e-cigarettes? Some statements have been made, such as e-cigarettes reduce most of the harms from tobacco smoking, and to that extent they are effective. And these words are taken from a seminal report published in the UK by an authority named Public Health England. The Royal College of Physicians has also issued a report making the claim in line with the Public Health England report that e-cigarettes are about 95% safer than smoking tobacco cigarettes. There's no question that short-term use of e-cigarettes appears to be safe, with very few side effects. Throat irritation and so forth are quite commonly occurring, but there's very little evidence from randomized controlled trials of increased harm from using e-cigarettes. There are a lot of studies looking at the toxicology of vapor, and there are a handful of biomarker studies which I'll mention briefly. But the effects, as I said, of long-term frequent use are unknown. We don't know much about second-hand exposure risks apart from knowing what's in the vapor and thinking that they're pretty minimal. And abuse liability potential, very limited data on that. But of course you could put your marijuana liquid or what have you into an e-cigarette and use it to vaporize it, I guess, if you want to do that. So a recent publication in Environmental Science and Technology by Sleeman and others found that there may be some products resulting from the constituent propylene glycol and glycerin that could be harmful. These include acrolein, which is an irritant, a respiratory irritant, and formaldehyde, which is a potential carcinogen. We did some work looking at all the literature on harms that have been published on e-cigarettes and conventional cigarettes, comparing them with guideline levels. And these are the guideline levels for what's acceptable and not. And these are what conventional cigarettes and the little blue and orange levels, which are almost invisible, are from e-cigarettes. And I guess the message here is that conventional cigarettes are far more likely to expose you to harmful levels of toxicants than e-cigarettes as a rule. A colleague of mine has looked at the literature on biomarker studies, which can provide perhaps the most reliable estimates of exposure and potential chronic disease harm to human health. They involve analysis of e-liquid and vapor composition and variety. Most studies of toxicants involve e-liquid and vapor composition studies in a variety of artificial lab conditions, whereas biomarker studies are more likely to capture the impacts from what vapors actually inhale, and regardless of how they use these products. There are about 16 studies between 2015 and June 2016, and they all point to lower levels of risk for vapors compared to tobacco smokers. So that's an important point, is comparative risk. Carbon monoxide, 0. Cancer-related toxicants between 0 and 23%, that of tobacco, and for cardiovascular and respiratory toxicants, at least half that of tobacco smoke. And there are other exposures and potential harms that have been highlighted by a recent systematic review by Hua and Colbert, published in 2016, looking at things such as intentional suicide, overdosing on nicotine e-liquid, accidental overdose, particularly amongst children, mechanical injury from exploding and combusting e-cigarettes from faulty products, as well as the health harms. So there's no question that poisoning calls have skyrocketed since e-cigarettes have become available. Here's some data from Campaign for Tobacco-Free Kids. Assessing harms, it's quite good to do this in a systematic way, and work by David Nutt and colleagues in the UK that informed the Public Health England report tried to break product harms down into these sorts of ways of thinking about them in terms of product-specific mortality and morbidity, dependence, loss of tangible outcomes, loss of relationship, crime, family adversities, international damage, economic cost, community harms, etc. It's quite a comprehensive way of assessing harms, and they came up with a conclusion based on a sort of expert panel following this tree through that the harms of smoking of using e-cigarettes, were 95% lower than that of conventional cigarettes. And on a kind of continuum, cigarettes much more harmful than anything else, and other tobacco combustible products like cigars, pipes, small cigars, hookahs, water pipes, snus, oral tobacco, and then electronic nicotine delivery systems. And then you've got pharmaceutical nicotine products and patches and so forth, which are inhalable, very, very low harm. Okay, wrapping up here, perceptions of harm show that there are, despite the products essentially being the same, people who in different countries, parts of the world, perceive these products quite differently. And I guess depending on your perceptions of harm, you may be more or less likely to want to use them. But there's no question that in the UK, where e-cigarettes seem to be much more popular and there's a more liberal approach to their use by the health authorities, they're perceived as being less harmful by more people. Okay, what's happening in the US? Well, some interesting study data coming out from the analysis of Child Health Survey in California by Barrington Trimis, just published recently, suggested that total use of nicotine products was actually going up as a result of the advent of e-cigarettes. So perhaps some evidence here for the gateway effect, but this hasn't been substantiated anywhere else in the US at this stage. And the other thing is that smoking in the US, despite the advent of e-cigarettes, is going down year on year and continues to do so, even during the years when e-cigarettes have become increasingly popular. One of the problems with tracking this gateway hypothesis is that the measure of e-cigarette use that's widely used in surveys is at least one use of e-cigarettes in the past 30 days, which could just be a single experimentation rather than a kind of committed vaping pattern. So we need better measures to be able to track what's going on with e-cigarette use, particularly in young people where there are concerns of harm if they were to take e-cigarettes up, and particularly if they were then to graduate, if you like, onto cigarette use. So we need regulations, I believe, that balance the benefits with the potential harms at both individual and population levels. So these might include controls on sales and marketing and use in some settings, and quality standards for devices in e-liquid. And in New Zealand, we are moving very much in that direction. There's a consultation document, and the tobacco control and public are able to have sectors are able to have input into government regulation, and we hope to have a decision on that by the end of the year in New Zealand. It's likely we'll have nicotine-containing e-cigarettes on the market, but with some controls. These products are already available in the marketplace. They're online readily. There's limited information available. There's a diverse range of products and use patterns, and the tobacco industry is involved. So we do need some regulation, and the FDA is grappling with this, I'm aware, at the moment. But I guess there's a real issue that if they crush the indigenous industry, they might give strength back to the tobacco industry. So there's a risk with regulation being too heavy-handed and being too light touch, and finding that sweet spot is a real challenge, and I'm glad I'm not in the regulation game. So in summary, are e-cigarettes an opportunity or a threat for health? I think there are opportunities for e-cigarettes as an option for smokers who want to quit and reduce harms to their health, possibly improve their health. There's possibly a prevalence reduction opportunity here for populations, particularly if mass substitution was to occur. But that presents some threats, and we don't know a lot about the long-term health harms of e-cigarettes. Fuel use is certainly widespread, and any cigarette is a bad cigarette for health. There's the risk of gateway, renormalizing smoking behavior, and reinvigorating tobacco industry. And this could lead to division amongst, and is already dividing, the tobacco control sector and distracting them from the main game. So I'd conclude that e-cigarettes are a disruptive technology presenting both opportunities and threats to individuals and populations, and the jury's still out from the long-term health harms. However, most experts agree that for individuals anyway, they're far less harmful than smoking, and the balance of population harms versus benefits will hinge really on how we regulate them country by country. Monitoring and research are going to be essential to track what happens in response to regulation. But I think in order to go forward in the research space and in our discussions with regulators and the public and healthcare providers, we need to have respectful, constructive discussion and debate based on high quality data. And that's going to be essential to achieving our common goal, which is to end the tobacco smoking epidemic. Thank you very much.
Thanks, Chris. Let's have one or two short questions from here. Any questions?
Stunned silence.
Okay. Thank you so much, Chris. It was great. Very interesting talk.
Great. Pleasure.